Hello, welcome back to Prepping for the Unknown with me, Alexus.
And Saden.
In today's episode, we will be discussing some medical tools and how to use them. So, Saden is a firefighter. Why don't we hear more about some of your medical calls?
Alright, so we get multiple different calls. We get falls, we get sick people, we get the old people stuck on toilets, and there's multiple other ones such as car accidents with injuries, so on and so forth.
I currently have a kidney issue going on, so that's been a decent struggle for me. Within the past 2 years, I have had one major surgery for my hip to get a screw put in my hip. It's super fancy, so they use the word Skippy to abbreviate it. Basically, I had outgrown my growth plate and needed to have a screw put in to hold the joint in place. I also have history with ear infections, having tubes in my ears, taken out, put back in, and then taken out. Then I've had to have skin grafts on my ears that have fallen off, then had to be put back on. It's been a challenge. Saden, do you have any medical conditions you are willing to share?
I have none.
Any past medical experiences, like hospitalizations?
Went to a hospital after a motor vehicle accident in 2016. That's all.
Some of my essentials I would have in a medical kit, like easy to go bag, would definitely be Band-Aids, Neosporin, gauze, medical tape, super glue, because it's decent. And that's all I can think of off the top of my head. Now over to our guests to hear their advice.
Hi, I'm Nurse Jen. I'm a registered nurse here at the Corning Painting Post High School. I have past experience. I graduated in 2017 and worked at Arna Ogden Medical Center. I then did home health care, and then I moved here.
What specific medical supplies are necessary to have on hand for an emergency situation?
So everything you said for the medical kit was really good. I would add in either peroxide or like an alcohol, like a 100% proof alcohol, just to disinfect anything. And I'd make sure like clean, thick cloths in case you have like a heavy bleed, so you're not going through all of your gauze pads at once. If you can get any tourniquet type items, that's also a really good thing to have in hand. Also, anybody, if you have family members who have like medical conditions such as diabetics, or I have Hashimoto's, so I have to have thyroid medication. Anybody who has a disease where they would have to have supplies, having a backup supply of at least like 6 months is essential.
So, how should medical supplies be stored to ensure they remain effective?
So medication-wise, you usually want to store them in a dark, dry place. So like usually in a tub, like in like a closet, not your basement, so they're not getting that dampness. The rest you want to keep in the packaging so they don't get dirty, don't get bacteria on them.
Are there any specific training courses or certifications needed to effectively use medical supplies in an emergency scenario?
I mean, yes and no. It's great to have that backup stuff, to know CPR, or if somebody's choking, how to do the Heimlich, or how to do a tourniquet properly. But if it's an emergency situation where you have no other choice, there's actually a law that says, you can do no harm. So if you're trying to help somebody, you won't be held accountable for it. So it's better for you to jump in than just to leave the situation.
How do you determine the appropriate dosage for or applications for medical supplies in an emergency?
Um, like medication wise, like an
Yeah.
antibiotic, usually you just go by whatever you're kind of seeing on the bottle. You also go by body weight, age. If they're a younger patient, they're smaller in weight, you're going to want to do less. Less is always better. If they're, a bigger person, 300, 400 pounds, that same dosage isn't going to do much of anything. And you also need to look at the severity of, if it's an infection, how bad is the infection? They're going to need higher dosages.
What are the most common types of injuries or conditions that would require the use of medical supplies in an emergency?
Working in home healthcare, I would have to agree with Saden. We saw a lot of falls from elderly patients, a lot of broken bones. Motor vehicle accidents are huge. Came into the ER all the time. Infections like pneumonia, C. diff, those are also really, really big.
If you were to make a little survival kit, what medical supplies would you put in it?
I would have everything, the gauze, tourniquets, alcohol or peroxide, the clean cloths and Band-Aids. I would also have like clean scissors, possibly like scalpel or pocket knife type thing. I would also probably have some antibiotics, antibiotic cream in there, clean water supply, at least a couple bottles so you can wash off the area with clean water because you don't know if you're going to have that.
I've seen on medical TV series they would use alcohol, like drinking alcohol, to disinfect stuff. Does that work?
It does. Yep. It just has to be like high proof.
In a grit down situation, when you are out of medical supplies, where could you go that would be less noticeable to get more?
I personally would find they're called like mom and pop pharmacies. So not like your CVS or your Rite Aid, like a small town pharmacy, because people are less likely to think of them, but they are going to have the same supplies that everybody else does.
In a situation where you do not have a tourniquet on hand, what could you use instead?
Anything that you can make tighter. So a belt is a great option. You don't want to use anything like a string because you can actually cut the skin. A belt, like a ribbon, a thick ribbon, anything like that would work.
Would you recommend, for a bullet hole, putting a tampon in it?
If it's for like to stop the bleeding?
Yes.
I mean, if it's your last resort and you have nothing else, I mean, I guess also it would depend where it was. Leg-wise, yes, I probably would. Chest-wise, no.
Do you have any strange medical stories?
Oh, gosh. Yes, lots.
Can we hear some?
Sure. Probably one of the weirdest experiences when I worked home health care. So you would go out and see patients, you'd be by yourself. I had a gentleman who was 80 years old, and this was my first time meeting him. He lived in the middle of nowhere, no cell phone service. I got there and I could hear him inside the house rummaging around, but the doors and windows were locked. So I had to go through a window, and when I got in the house, it was, I mean, you could barely walk because there was so much stuff. And then rabbits just started appearing out of everywhere. There was just rabbit poop, and there was easily 30 rabbits. It was a single trailer. And he was covered in clothing that had probably been there very, very long time, with a shop vac, trying to vacuum his hair off. And he had been feeding the rabbits yogurt, but they had also been eating the couch. I was there for about 4 hours. I had to go back out the window, drive down the road till I found cell phone service to call 911, then go back and take the shop vac from him and try to get the rabbits in a room, and yeah.
That's really strange. I wonder what his thought process was.
He had no idea what was going on. He was vacuuming his hair off.
I mean, maybe he's seen that video where you like vacuum it into a ponytail.
Maybe. He had a lot of hair. I want to know where he got all the rabbits from, because he didn't drive, he didn't leave, he had just been there by himself.
He might have started with just 2 rabbits and they probably multiplied.
Yeah, because they were everywhere, and he was feeding them Greek yogurt.
That's not
Or trying to feed them Greek yogurt. I don't think they wanted it, but they were desperate.
That's kind of sad.
It was really bad. And then when the 911 people came, the EMT came to get him, they came up the ramp, and one of the EMT guys was a little bit bigger and went through the ramp, because it was like it was wooden, and it was just 800 years old and rotted, and he just, boop,
oh no,
went down through it. Yeah.
Is there any other weird stories?
Oh gosh. My first ER patient came in, again, an older gentleman who had been by himself. He had been sitting in the same chair for probably a month or more, with no water, no electricity, and he was probably 350, 400 pounds. And we couldn't figure out what the smell was. And then we turned him over, and there was a bowling ball size hole in his back, where from sitting for so long that it had just eaten his skin.
That can happen?
Yes, and it does. He did not make it.
I didn't think he would.
No.
How do you assess and prioritize the use of medical supplies in a mass casualty situation?
Medical supplies, I guess I would go by what supplies you don't have a lot of. Use those sparingly, and when you're in that kind of situation, you triage patients. So by severity, we have different color tags that go on different patients. You basically use the supplies on the patients who you know you can save. If you can't save a patient, sounds bad, but you don't want to waste a supply on a patient you can't save.
That makes sense. Do you have any tips for stuff around the house that you could use for medically?
Oh, yeah. Obviously the first aid kit, clean water bottles. I would always keep like some sort of lighter or fire kind of thing in case you need to like cauterize something. Like we talked about tourniquet items, if you don't have a real tourniquet, put a belt with your stuff, clean cloths with your stuff, some alcohol, peroxide, Tylenol, ibuprofen, things like that as well. You're going to need those.
Let's say you're a diabetic and you ran out of insulin. What should you do in that situation?
If it were my family member and it was, kind of mass chaos, I would, like I said, find a mom or pop pharmacy and get all the supplies you can, because there is really no equivalent for insulin, unfortunately. So you really don't have any other choice.
If you were bitten by a rabid animal, what should you do? What should be your first step, second step, etc.?
You need to go to the ER. You need to have rabies shots. Rabies is not curable if you don't have rabies shots, so that should be your number one. And then you should also call animal control, because you don't want that rabid animal running around continuing to bite more people.
Yes. What are some things you could use to make a splint at home?
If you have, pieces of wood, or even cooking utensils, like a flatter one, and then wrap gauze. You could rip a pillow sheet and use that to kind of go around those. Anything with a flat surface, and then something soft to go around it.
I had seen a video that they used one of the blood pressure cups to turn into a tourniquet.
Mm-hmm. Yeah.
Would you recommend that in an emergency situation?
Yeah, absolutely. Pump that thing all the way up, and yeah.
Saden, do you have any weird medical calls?
Oh boy, here we go. So, one of the weirdest calls I've had was a elderly woman who fell. She was about 200, 300 pounds. I had just got on scene, and my chief had his POV there, which was being changed because we were auctioning that truck. So he had nothing in that truck. So when I arrived on scene, he had to run back to the station to grab a backboard. And we got multiple different backboards. We got one that's flexible. So the plan A was to get her up onto her feet using the backboard. So we had myself, my chief on one side, and then two paramedics on the other. And I believe it was her husband down by her feet. He had no shoes on. Didn't help that he had socks on, and it was a hard floor. And we go to lift her up, and she starts sliding down the backboard because her husband or whoever it was starting to slide. So we gave up on that plan. So we had plan B, which was to lift her up, get her on the couch, and sit her up. So we go to do that, and there was a coffee table in the way, but we made it work. So we get her up on the backboard. We're spinning her around to get her on the couch, and one of the AMR paramedics tripped over the table, fell onto the couch. She fell on top of him, and I believe it was her husband was in the background and yelled, "Man down, man down." And we all started bursting out laughing. But that was one of them. I ran one medical call all by myself because nobody decided they were going to show up till last minute. It was for a possible stroke victim, so I was actually on call with her at the time of it, and I ran out the door, went down, because I live right next to the call that it was. So I went straight to the scene. I walked in. There was a blind man, which was the victim's husband. So I announced myself because I didn't know if he could see me or not at that time because he had sunglasses on inside. So I figured he was blind, and I didn't know where his wife was. And I announced myself, and I had to make sure to say fire department before moving in. And then I got in. She was sitting up at the table, and I went over, asked her for her name, her date of birth, such things like that. And then I went through and proceeded with the basics of seeing if you had a stroke, which is, fingers out, squeeze them, make sure they have the same amount of pressure on each hand, smile to make sure there's no droopiness.
Taking one of those tests is hilarious. They ask you to do all sorts of weird stuff.
And then when AMR arrived, they did more as blood pressure, stuff like that. And then at the end, it was just her not having enough sugar in her body, so she ate some crackers and with peanut butter, and we were okay to go. But that's another one. And then one of our one of the neighbors that I live near, she calls in pretty a lot. So we know her like good.
So it's safe to say you're on like a first name basis.
Pretty much for like the other first responders, like my chief and his wife, but yeah. She usually calls in for like tiny breathing problems with her breathing machine. One call that I responded to, she was having troubles breathing, I guess. And when we got there, her machine, it was on, but apparently AMR, when they took her, didn't give her back her nose piece. So she didn't have a nose piece to hook into her breathing treatment. So she called us, and then some reason she keeps smoking. And her husband's like, I don't know where she gets all these cigarettes from. So, I don't know. And then, yeah. Those are the weirdest ones, but...
My favorite was when the bigger patient had fallen on one of your arms. That was hilarious.
Man down.
Yep.
That's great. What are some things you would take from our conversation today and maybe use in your future?
Definitely the first aid kit, preparing that. Mine is probably not fully stocked and ready. And having like a backup supply for any of my family members who have diseases that, need things.